Today, we are focusing on contact precautions, a topic the NCLEX loves to test through priority and procedure-based questions. These precautions are for diseases that spread through direct or indirect contact with the patient or their environment. The exam will test your ability to act, not just know the definition. For example, a question might state, a client with vancomycin-resistant enterococcus, or VRE, needs their linens changed. Your immediate thought must be gown and gloves. The key is to remember which conditions require these precautions. Use the mnemonic V-CHIPS to remember the most common ones. V for VRE, C for C. difficile, H for herpes simplex, I for impetigo, P for pediculosis or lice, and S for scabies. These are the bugs that stick to surfaces and hands. The NCLEX loves to trap test takers with personal protective equipment, or PPE. For contact precautions, a gown and gloves are always the minimum requirement when entering the room. A common mistake is adding a mask when it is not needed. Unless there is a risk of splashing or aerosol-generating procedures, a mask is not required. A question might ask what PPE is necessary for turning a patient with MRSA in a wound. The answer is gown and gloves only. The most heavily tested exception is Clostridioides difficile. C. diff spores are resistant to alcohol. The exam will give you a scenario where you have 4 options for hand hygiene after leaving the room of a patient with C. diff. The only correct answer is washing your hands with soap and water. Choosing the alcohol-based hand sanitizer is an immediate failure on that question. They will also test this concept with environmental cleaning, where bleach-based disinfectants are required to kill the spores. Another common exam scenario involves patient placement. A patient on contact precautions must be in a private room. If a private room is not available, the NCLEX will test your knowledge of cohorting. You can place the patient in a room with another patient, but only if that patient has the same active infection with the same microorganism. You cannot room a patient with MRSA with a patient who has C. diff. Finally, consider equipment and transport. All equipment, such as stethoscopes and blood pressure cuffs, should be disposable or dedicated to that patient's room. If the patient must be transported out of the room, you must ensure any infectious drainage or wounds are covered with a clean dressing, and the patient is covered with a clean sheet to minimize environmental contamination. It is your responsibility to notify the receiving department about the patient's contact isolation status. The key to passing these questions is thinking about breaking the chain of transmission at every step.